those of you who don't know me, my name's Claire Austin. I'm Pro Vice Chancellor and Dean of the Faculty of Health Social Care here at Edge Hill University. And I'd like to take this opportunity to welcome you all to come today to tonight's inaugural lecture. Welcome also to those who are joining us online. So thank you all for coming to join with us and celebrate Michelle Howarth's inaugural lecture. Inaugural lectures are great opportunities for the university. They're an opportunity for us to celebrate the work and achievements of our staff and for individuals to share their research and achievements with the wider university community and with external stakeholders, friends and family. And while I know Michelle's always keen to talk about her research, I know speaking about her own achievements isn't always easy for her. She's a very modest person. And in fact, when I asked her if there's anything particular she would like me to say in this short introduction, she told me that she wanted tonight to be a celebration of all those who've helped support her and her research. And of course, she's absolutely right that research doesn't happen in isolation. And partnerships are key to all aspects of research, from identifying need to developing and delivering research through, of course, to implementing the findings. And I know many of the people Michelle has worked with are here today to celebrate with her and to recognise her achievements. And of course, she has many achievements. So, a bit of a potted history. Michelle started her professional career as an adult nurse, and she moved into academia almost 25 years ago when she was appointed to a lecturing post at the University of Salford. So she joined us at Edge Hill about 3 years ago as a senior engagement fellow, and I think she was the university's first senior engagement fellow. Michelle's work and achievements were soon recognised, and she was quickly promoted to the position of Professor of Health and Social Care. Michelle specialises in social prescribing, and I had to write this down, nature-based, person-centred approaches to health and well-being. And her work and expertise is nationally and internationally recognised. She's a member of the National Social Prescribing Network and chairs, and again I had to write this down, the International PERSI Network, or Personalised Care Interprofessional Education Network, and that uses research, curriculum development and placement opportunities to raise awareness of social prescribing and personalised approaches amongst health and social care professionals. Michelle chairs the Greater Manchester Social Care Nursing Advisory Board, which is working to raise awareness of social care nursing. Michelle's published extensively and has been awarded a wide range of research grants and contracts, working with a wide range of organisations and partnerships. As I'm sure she'll tell you, she's currently involved in major funded projects, including the Arts for Us and the NHR-funded Mental Health Leadership Award. And these are some of the biggest awards the university's ever had. Michelle is a fantastic colleague, though, a great team player, and she's always happy to help, and she is so well respected by all, and I think it's a testament to that there's so many people here today. But really, really importantly, and I know this is really important to her as well, her research and broader work is having a positive impact on education practice, on individuals and on communities. And it gives me great pleasure to invite Michelle to deliver tonight's inaugural lecture entitled Time for a Natural Health Service.
Thank you. Thank you very much. Thank you. Wow, thanks. At least I'm not blushing, because I normally blush when people talk about me like that, so thank you so much, Claire. And yeah, I just want to reiterate, I'm so honoured and humbled that so many people are here today. Friends, family, colleagues, people that I've worked with, services that I've supported. And I just want to say thank you from the bottom of my heart, because as Claire said, research doesn't happen in isolation. And I'm reminded by a colleague, the late Professor Martin Johnson, and he was a professor in nursing at Salford University. And when I started my academic career, Martin actually said, it's personal, you know, research is personal. And he's right, you wouldn't do it. You would not do it unless you had a passion in it, unless you had a real interest and a keenness to make a difference. And I remembered what he said all these years later. And so I'm hoping tonight to be able to talk to you about my personal influences, my professional influences, a focus on the research a little bit, not too academic, and then the impact as well and the next steps. A lot of the photos you see are the photos that I've taken. And yeah, hopefully you'll see my journey throughout these slides. So without further ado, the first thing I want to do is take you up a hill. And I don't know if anyone recognises that hill. My husband and son certainly do. So this hill is called the Hell Hill, and it takes you to a place called Gaddings Dam. And Gaddings Dam is a place where people go swimming, believe it or not, myself included. I don't know why it's called the Hell Hill, apart from the fact it's really steep. But on the way up, you hear skylarks. They're absolutely beautiful to hear. And I know they're skylarks because I've got them on my Merlin app, but you can't see the little devils. And I kept thinking, why can't you see the little devils? And the other night, I was literally pondering on this. And I've been reading Raina Wynn's book, The Salt Path. I don't know if anyone's read this. And it's about a true story about a woman and her husband that have lost their income, their family home. The husband's been diagnosed with cancer. I've not quite got to the end yet, so if you have read it, don't tell me. And essentially, they decide, right, I'm not going to take this line down. So they go and walk the southwest coast. And this is a description of their journey. And in it, the other night, I read this little passage about skylarks, and it all made sense, so I'm just going to read it to you. Skylarks rose overhead, hanging just out of sight, singing endlessly, till they dived back to earth to take a breath. So I thought, that's it. All the little devils have dived back to earth to take a breath through the beaks while I'm looking around for them. But I know they're there, and it's a beautiful walk up. That photo was taken probably about 7:30 in the morning. And it's the best time to go up there because there's nobody else there. It's great. Anyway, onwards and upwards. I've got a passion for being outdoors and for nature. And I always have. And when you get to the top of the hill, that picture on my right, that's actually Gaddings Dam. It was built in the 1830s to serve by the mill owners to service the mills at the time. And what you'll see in this bottom corner here is an aerial shot. I haven't taken that one. But right in the corner there's a beach. And Gaddings Dam claims to have the highest beach in Britain. And there are two stories as to how that beach got there. The first story is that the mill owner realised that the people, the mill workers, couldn't afford to go on holiday. So he put the beach in, which I think is lovely. The second story is this a geologist view, is that because of the prevailing winds and where it is, and it's up a hill and it's quite windy up there, that beach was created naturally. I prefer the first story because I just think, isn't it a lovely idea that somebody with all that money would allow and enable people to go and experience nature? And I don't know which one is true, but when you go up there, it is windy and it is chilly. The other picture is me when I was about 9 or 10, with some rather groovy red shoes, stood by the side of the sea. And what you won't know after this, but I was in that sea shortly after this picture was taken. I've always loved nature. I've always loved being in the water. I've always loved walking. And you kind of think, well, this is what's influenced me. And if I'm getting all these benefits from nature, why isn't everybody else? Why isn't everybody else? So the question tonight is it time for a natural health service? And I have to confess, I didn't make up the title Natural Health Service. It's out there already. The Wildlife Trust own it, the National Heritage own it. People have been talking about a natural health service for a long time. And I want to ask, what strategies are needed to maximise the benefits of nature for all? is it actually possible to envisage a natural health service? And what the heck's a natural health service anyway? So hopefully we're going to kind of explore that in tonight's lecture. And I'm not saying I'm going to give you the answer, I'm just going to talk about the evidence base that we have. But first, I just want to say thank you to two really special people in the room, and they're both sat next to another special person. So my husband, Martin, and Cam. Been amazing. And if anyone's been on a Teams call with me, Wednesday the dog is there. And even she's been taken up the hill to Gaddins as well. And here comes another amazing friend, Carol. Thank you. So, yeah, where to start? Right, well, I'm going to take you back in time. And as Claire mentioned, I'm a trained nurse by background. I went into nursing when I was 18 years old, and now I'm 56, so it's a long time ago. And when I went into nursing at the time, there was the huge AIDS crisis. Does anyone remember those awful, awful adverts? I remember them really well because I just thought these are really scary. What struck me the most was the gay community seemed to get the brunt. It seemed to hit the gay community more than anybody else. And so they were stigmatised. They were treated terribly. And I remember having a conversation with my mum saying, well, not only is this a death sentence, because at the time we didn't have the drugs or anything to kind of cure this, but they're being stigmatised and treated so terribly. And where's the individual here? Where's the person? What's happening here? And so I went into nursing at that kind of period. And to be fair, I mean, everybody was quite scared. You've only got to look at COVID recently. Everyone was quite scared because we didn't know a lot about it. But it just always struck me that we're treating people with such inhumanity and disrespect. And I just thought, this is wrong, So I've always thought about, why do we label people? Why is it diagnosis? Where's the person amongst all of this? And what impact is it having on their lives? I don't know if any of you watched It's a Sin a couple of years ago. I cried throughout that because for the first time, it really highlighted the plight of the individual. And it was told by someone who experienced it firsthand and experienced a lot of her very good friends from the gay community dying, but being treated terribly. And it really did highlight that kind of plight. Interestingly enough, one of the first people that I looked after was a young man who had got PCP, which is a pneumonia as a result of HIV and then the AIDS, the autoimmune disease. And he was on an acute medical unit, and I just kept thinking, not only is he fighting for his life, he's fighting for himself because he's been stigmatised and people are really wary of nursing him. And all of these things really do make you think about what is it we do as a nurse and where is that person within all of what we do. Sorry, I forgot to mention, that is the one and only picture of me in a nurse's uniform. We hunted high and low, but that's it. And I think I must have just finished a night duty because I'm smiling. So anyway, yes, that reminds me, and some people might have heard this before, but when I was 18, and when I went onto the first ever ward, I'd had 4 weeks training in a school of nursing, and then I went onto an acute 33-bedded male acute ward. And for those of you that aren't got a nursing background, when you go onto a shift, you get a handover. And so somebody, the head of the department, the ward manager, or head of that shift will go through all the patients that are on the ward and tell you what's wrong with them, what's happening to them, plan of action for that day. And so you're busy at the time, you're busy like scribbling down all these different things. So I just wanted to regale to you my first ward report because it stuck with me. Bearing in mind I was 18, bearing in mind the sort of climate. So bear with. Right, here we go. Bed 1, type 2 diabetic on SNS insulin stable, refer to dietitian. Bed 2, chest pain, query MI. Rest day 3, cardiac monitor showing sinus rhythm. Bed 3, hemoptysis plus, query cause for bronch, warfarin stopped as iron abnormal. Anybody get that? The nurses amongst us will go, yeah, class. It's like it's another language to other people. I didn't get it. I was like, what the hell's just happened? 33 patients in the space of like 20 minutes. I thought, where are the patients? All these beds. Quite literally, I don't think in a logical mind, but I really don't think. So my first ever ward task was to go and remove a Venflon from bed 19. And I genuinely thought I needed a spanner and a porter. I didn't actually realise that bed 19 was Mr. Smith, and he had a Venflon cannula in the back of his hand, and I had to go and take it out. And they promoted me here, and it's like, woo! So that really, really stuck with me. Now, a few years ago, one of my personal students came back from practice, and she wanted to share an experience that had happened to her in A&E. And they'd received a young woman, and she'd been in a road traffic accident, and she was incredibly unwell. You're talking, limbs and all sorts of blood and everything. And they were busy preparing her for theatre, and they'd rolled her over onto back, and they're all kind of super busy getting her ready. And she said, all of a sudden, this lady's mobile phone went off in a bag. And it was one of those mobile phones that had a particular ringtone. Ben, you were telling me about your partner's ringtone earlier. Yeah, that would have been scary. And they said all of them just kind of stopped and went, ah. They didn't stop treating her, obviously, but they kind of stopped because all of a sudden they think, there is a person. Here is a mother, sister, daughter, wife, whoever. And it just made her reflect and think, yeah, we do have to save lives. Yeah, we do have to treat people quickly. But we should never forget that there's somebody there. There's somebody in front of us, and it's a person. And so I know that this whole bed numbering continues, and that inspired my research. And so I was really interested in, well, what does person-centred care look like, and why is this happening? So I'd read a lot about around Michael Foucault, and in 1968 he coined this term, the clinical gaze. And the clinical gaze is basically where we look at somebody and we can identify signs and symptoms. We know how to treat you. We've mapped the human genome, the DNA structure. We know how far removed we are from a chimpanzee. We know all of this. We know how to fix people. It's a very biomedical, pathogenic model, very deficit-based approach. So if we know what's wrong with you, we know how to fix you, yeah, which is fair enough. This was exacerbated a wee bit during COVID, because you saw people go into hospital incredibly ill, go to intensive care and come out again. And, all of a sudden, we're heroes and we're fixing people again. And, that's fine. And Banksy's, did this image of, nursing as superheroes. But I was just reminded, well, what about the person there? Are we not exacerbating this culture of just wanting to fix people all the time? What makes us unwell in the first place? How do we know that individual? Where does that person fit with everything? If we knew more about the person, could we prevent something from happening? Could we improve their lifestyle and life chances? So my PhD explored what person-centred care looked like. And over a couple of years, I kind of talked to a lot of staff in a hospital. I talked to patients. And I came away thinking, well, I'm not convinced that it exists in the NHS because we're always about fixing people. And I'm sure if you go into hospital and you're unwell, you want to get better and you want to come out feeling better. And then I was talking to somebody and I was saying, what does person-centred care look like? And they went, well, there's a garden centre just round the road that's doing this. I went, what, really? And they said, these people turn up. They have something called therapeutic horticulture, and they've all got mental health problems, but they say they don't feel stigmatised and they're having a really good time and they're all volunteering up there and it's working wonders. So I turned up at the garden centre. I literally went up there. It was near Curzledale and it's still there today. And it's called Garden Needs. And essentially, people were being referred there to work with nature, basically. So there was it was a small site, and at the time it was just a little porter cabin, and they had raised beds, and people would be given duties, whatever they wanted to do: sow seeds, dig holes, grow plants, just sit around and chat. So I said to them, "Have you ever evaluated this?" And they went, "No." So I said, "Would you like it evaluated?" And they said, "Yes." So we did a really, really small scale evaluation. We talked to some of the beneficiaries, and we took some qualitative data. And everybody that went there was saying, "Yeah, this is brilliant. I don't feel stigmatised. I've had a mental health problem for years." One person had actually come out of her house for the first time in 10 years, and she gradually worked up from the bottom of the garden because she didn't want to be with people, and worked her way up to the top of the garden where she was working with people. And so the impact was huge, and we captured that. We wrote a report for them. We then published it as well. And what's absolutely brilliant, and this was my first kind of insight into the potential impact of research, is that they used that report to help them submit a bid for a larger grant, and they were successful, and they got a huge grant. And then they said, "Do you want to come back and do another evaluation? We'll pay you this time." I said, "Yeah, okay, we'll do that." So that impact is massive, and that Garden Needs is still going today. I invited the original director here today, which unfortunately she couldn't make it, but it's still going strong today. And it was just the first example of how nature can really help people with mental health problems, and a whole range of other problems as well. But then you don't have to convince me. I'm already wedded to this. I know this. And we know, for example, that nature impacts on every sense, every sense. This is where I'm going to get my glamorous assistants to hand around some herbs now. So we know that smelling things like mint. Anyone know any varieties of mint? How many varieties of mint there are, by the way? Apparently over 500 varieties of mint. There's only 2 varieties here. Yeah. When we smell herbs, we are boosting our neurotransmitter called serotonin. It's the happy hormone. Physiologically, and people, clever brain surgeons have looked at this on MRI scans. We are boosting people's happy hormone. So when you sniff a herb, when you have a herby tea, we've got lemon verbena going around, we've got mint, we've got lemon balm, we've got lavender. Don't smell too much of the lavender because you need to stay awake. But they've all got some kind of, effect, yeah? So that smell. Anyone been outside when it's just rained after a hot day? Anyone got that blast? Yeah, that real smell. Or if you get up first thing in the morning, take a lungful of air, that smell that you get is amazing. But when rain hits soil, again, it gives off another chemical called, I can never pronounce this, geosmin, yeah? And apparently, and they can edit this bit in case it's wrong, camels can smell this chemical miles and miles away, yeah? Which is why in the desert they can, because it's only triggered with water. It gives us a buzz. You're all going to leave here tonight feeling very happy because you've all sniffed herbs. Sight, and I mean herbs and yes. Sight. I booked this room particularly because of that view there. We know that having a view has an impact on you, and I'm going to explain a study in a minute that's shown that. If you've walked through the campus and you've seen how beautiful Edge Hill is, again, I love coming here, just walk through. Taste, apparently, food tastes better outside. Yeah, who knew? Soil in our skin, when we have soil in our skin, we absorb the microorganisms, and again, that can help boost serotonin. And then finally, sound, wind in the trees, rain on the window, birds. Who likes sound of birds? Yeah, loads. Have you all got the Merlin app? No, you're going to have the Merlin app. Me and Catherine have got the Merlin app. We are always on the Merlin app. So the Merlin app records the bird sound in your area and tells you what bird it is where it's from, the different calls and everything. And not only that, but it records it so that if you're having a bit of a dull day or a bit of a bad day, you can play the recording back to yourself and just go, ah, yeah? So you've got to get them, and I don't get commission for that either. So the herbs are, once you finish with the herb, pass them on, pass the smell on. Okay. Right, so if you don't believe me, what I want to do is take a mindful moment. So I've pinched this from Spring Watch. I don't know if any of you watch Spring Watch. It's normally at the end of spring. My son's so embarrassed. But this is just a 1 minute moment. It enables me to get a drink of water and you guys to have a bit of bird time here. If any of you can think of some fantastic facts to do with dippers, please let me know. I've got 4 which I'll share with you in a minute. So here's the technology working. I didn't want to stop that then. Those mindful moments go really quickly. Anyone got any useful facts about dippers? Shall I share my 4 facts? 1, they can stay underwater for 30 seconds and they swim with the wings, that's the second one. Third is their call is really loud so that it can be heard over rivers. And the 4th one, which is just the best one, they're born bobbing up and down. They literally are born bobbing up and down. Anyway, we know this. We know all of this. And from a health perspective, Florence Nightingale knew this in the 1800s because she wrote, "I shall never forget the rapture of fever patients over a bunch of brightly coloured flowers. People say the effect is not only on the mind, it's no such thing, it's on the body too." So we knew all of this. We know nature's good for us. There's been quite a lot of studies that have demonstrated this. In that where you can see the beds there, people have been for long term, people particularly in orthopaedics, where there was an opportunity to either get them out in the ward gardens or push the beds outside, they would do. We know that if you expose people in intensive care to more sunlight, they are less likely to get delirium and hallucinations after they've recovered. We also know Ulrich's study in the 1980s, which has since, there's been lots of studies since, has highlighted that when you get a view, if you put a group of patients who've had a gallbladder removal, which is what Ulrich looked at, and you compare the recovery rates and the painkiller use with the ones that have looked at a tree and ones that have had a view of a brick wall, the ones that have had the view over the tree recover quicker, have less painkillers and are out the door a lot sooner. And yet our hospital windows get smaller. But we used to send people to recover in the middle of the countryside, didn't we? You recover from shell shock, the first thing to do is packed off to a huge hospital in the middle of nowhere with a grand vista. But now I think more and more hospitals are buying back into the fact that nature is good for you. I don't know if those windows are getting any bigger. But the one thing that kind of tipped me off the most is they stopped flowers coming into hospital. And I can only assume that it was because of allergies. But I think, has anyone actually done a benefit analysis of this? How many people have gone, have a sneeze versus how much people get benefit from flowers? So they stop flowers. And that bottom picture, I don't know if anyone recognises that. Kirby Lonsdale, Ruskin's view, So Ruskin knew it, a view, being in nature, it's all good for us. And why is this important now? Because we've got a huge rise in long-term conditions. We know that mental health, we have poor mental health more than ever before. 1 in 5 children have poor mental health. Mental health is rife within adults. People are socially isolated. We have an obesity crisis, type 2 diabetes. Labour has called our NHS broken. It's probably been broken for a few years, but it's definitely broken. And now, when we finally get the NHS plan, there is going to be a shift from acute care to prevention and community-based care. And we're going to start thinking about strengths-based approaches and what matters to a person, not just about what's the matter with them. And so for me, this is an ideal time to get the idea of that natural health service embedded into systems as we start to see that change. So it's incredibly important. And we also know, apologies, those are my boots at Sen and Cove last year. But we also know, because research has told us, my own research has told us, that it increases happiness. It can increase your happiness. It improves our mental health. It improves physical activity. The recent Green Social Prescribing Economic Evaluation that we've done, Nicola's here, I think, yeah, and Sean, and people have been involved. The results from that show us that not only does it improve mental health statistically and that it's economically beneficial, but the types of people that benefit most from the nature are those people that are from the deprived areas as well. So if you get people from deprived areas coming in, they are the most likely to benefit from this. We have improved life satisfaction, and there's also emerging evidence that it can actually support, in some cases, return to work. And it can save the NHS money. So the recent report, which was a national report on green social prescribing, which I shall get to in a minute, Hayward et al. Demonstrated that for every £1 invested is worth £2.42 if you invest in nature-based interventions for wellbeing. Am I convincing you? Okay. So how do we get nature into healthcare? One of the first experiences I had of, apart from garden needs, of care or social farming, or where they use nature, was on a social farm called Botton. And Mike, correct me if I'm wrong, it's the top of the North Yorkshire Moors and turn right, yeah. And essentially, I went out there with Mike and another a colleague called Graham. And we visited this place, and it's a place where I think it was Matt Millans gave over to, I think he had a son that was disabled, and he handed over this land, and now it's owned by Camp Hills Village Trust, and they have a huge area. It's a bit like going to Hobbitsville. It's absolutely stunning. And people live in, it's mainly people with learning disabilities, but there's a dairy there and farm and all sorts of things that they can grow. And they've been going there, this has been happening for quite a long time. And GPs refer in there, so people can be referred for nature-based interventions. So that was kind of my first experience of that kind of larger scale operation. But first of all, before I dive into green social prescribing, I just want to explain a little bit about what social prescribing is. So social prescribing is what I think a way of getting nature into healthcare. Is where a clinician, whether that be a nurse or a GP, can refer an individual for a non-clinical reason to a link worker in the community. And that non-clinical reason might be anything from mild to moderate mental health issues, anxiety, loneliness, etc. They're referred to a link worker in the community. The link worker or community connector, they've got a variety of names, has a wellbeing conversation. And that wellbeing conversation is based on what matters to that individual, not what's the matter with them. It's a very strengths-based conversation. They have a conversation with the individual, and then they refer them on to somewhere within the community. Now, these link workers or community connectors are amazing people because they often lived and worked in that area. They have asset mapped the whole community. They know where every group is. And they refer on. They take them there, they make sure they're okay, and that person then goes on and hopefully thrives. So that's social prescription. It's a process. When it's called green social prescribing, it means that at the end of it, they're prescribed to a nature-based intervention. It might be a blue space as well. So when we talk about green social prescribing, it's actually, I think there's a shift now towards talking about nature-based social prescribing because it involves blue spaces as well. So when people arrive for an intervention, a nature-based intervention, it's typically a 10 to 12-week program. It's usually delivered into small groups, and they might do a variety of different things. And there's different ways in which we can explore how nature impacts on them and the different levels of nature. So they might be digging a big hole, they might be in a walking group, they might be sowing seeds, they might be growing hanging baskets. There could be a whole range of different things. The key is that they are engaging with nature, and then us researchers go in and we measure that. However, the link worker role, the community connector role, was funded up until April 24 last year, and now they're part of a range of other types of roles that are working predominantly in primary care, but sometimes within voluntary sector organisations. However, where the person is referred to isn't funded. So they don't get that national fund in the same way that the link worker did. And that's always been a bit of a sticking point. So where that came from. So if we really want to get nature-based interventions as part of a natural health service, we have to think of ways in which we can grow the evidence base to support those communities, those assets that are helping these people. So in that top corner there, I was talking to Bruce earlier. This was like a very large and a long projected study because it took over through COVID. We did the State of the Sector report survey for Greater Manchester, and we mapped all the voluntary sector organisations. And at that time, back in 2021, I think, there were over 17,500 VCSFE organisations in Greater Manchester across those 10 localities, of which 71% are micro. So they bring in about £1,000 a year less. And the others are, you know, larger, middle and larger organisations. Those organisations might only bring in a small amount of money, but they're having a big impact. So for me, it's like, well, how do we enable them to get the evidence base, to get, like we do with garden needs, how do we do that? The Nature for Health programme is one that we've been working with, which is an amazing programme of delivery partners across Greater Manchester that we've been working with at the moment to do their economic evaluation. And so we know this is working because our evaluations just said it's working. But the funding is a real sticking point. So part of this is to be able to grow the evidence base so that we can support the voluntary sector organisations and other community groups and programmes to enable them to go for grants. But that's not the solution, and when I get to the end I'll explain why. So one of the examples that we worked with a few years ago was the Wellbeing Garden at RHS Bridgewater. I don't know if anyone's been there, but it's a lovely place to go. And in the corner there you can see Ezekiel Brewster, who's the therapeutic gardener who's still there today. And again, one of the projects we did was we worked with the director of the Bridgewater at the time, which was Anna De Silva, who's now at Northern Roots. And we put together a bid to Salford Primary Care together to obtain some funding to set up a wellbeing programme and then for us to evaluate it. So we did that. Ezekiel was recruited as part of that, and that wellbeing programme was set up. We had, I think, over 77 people that came through prescribed route at the time, but then we opened up the referral pathways. And again, we talked to people about their experiences and we said, what's it been like for you? The number of people that said, it saved my life, was, you know, every time we talk to people, it saved my life. This is having a massive difference on people's lives. They talk about getting their mojo back. They talk about being engaged with other people again. They talk about being able to connect again. And not only that, but once the programme had finished, they'd all made really good friends, so they wanted to continue. So they still go there as volunteers and they help out. And that does happen quite a bit because I guess when you've got a 12-week programme, what happens after that? And you know, this isn't without its challenges. What happens beyond that 12-week programme? So that was an early example, and I'm glad to say the Wellbeing Garden is still going strong, and we still have a really good partnership with them. And Aziz is still going strong, and if anyone's heard her speak, she doesn't use slides like me, she just goes off on one. She's amazing, really passionate. We've published along the way, and I've specifically put up Cultivated Therapeutic Landscapes, which is Jess wrote a chapter in there, so Jess is here tonight, and she's been awarded a PhD recently. And we've written up the growing spaces. Another PhD student, Louise Mitchell, also did some work with people, older people and people with learning disabilities, and literally took blood samples and saliva samples and tested that and demonstrated how effective that was. And we published the RHS paper in Health and Place. Excuse the pun, but we are growing the evidence base. And it does need to grow, and it needs to gain momentum. More recently, again, we wrote a paper. It was a scoping review, and it was looking at what is the evidence. It's a really long title, isn't it, this? What is the evidence for the impact of gardens and gardening health and wellbeing? And we published it in the British Medical Journal Open, and we put in a logic model as well. And that paper has been one of their most downloaded papers ever, and which completely amazed me. But what's even more brilliant is on that left you can see a picture, that's Kyoto Hospital University. So there was a consultant neurologist who contacted me out of the blue, and he read this paper and he went, I'm really interested in what outcome measures can be used, because I want to set up a garden in the middle of Kyoto Hospital University for people with brain injury, and I want to know how to measure it and how to evaluate it. I went, oh right, okay, I can talk you through some things. And then he turned up in the UK and he had a little look around the RHS, and we've met since, and we keep in contact. So it shows you the spread and the reach and the impact that this is having. And also reminds me that publications aren't just an academic pursuit, they make a difference and they connect people as well. However, down to the challenges. The evidence base is growing, but it's not quite convincing everybody. I've been in an NIHR team science conversation today, and we were talking about this and the fact that if it's not a registered trial, and if it's not this, then you know, how do we convince commissioners? How do we do this? And that's based on the premise that we have an evidence-based hierarchy. And certainly within health, which are the types of people we're trying to convince sometimes, the more experimental the study, the higher the hierarchy is. So if you've got a randomised control trial, your randomisation helps to reduce bias, your control manages causality, and you can generalise because you've got a large sample size. Not bad for a qualitative researcher. You're proud, Carol. You're quite. Anyway, so, but these are really, really difficult to do in reality. And at the moment, working with some amazing people here, Penny and Mike, on a huge project, which is some randomised control trials over 6 countries to look at whether or not gardening is good for mental health. We know it is, but we have to do these RCTs to demonstrate it. So we're trying to get the evidence, and yeah, there's been a lot of learning, and I keep saying, you know, we have early career researchers in academia, and I keep saying I'm an early career professor because every day is a school day, and I'm learning such a lot by working with my colleagues to find out how do we set up a randomised controlled trial with the challenges that I'm going to describe to you in a minute. But now, what I do want to do is just take you through a tongue-in-cheek example. And as many of you know, one of my biggest go-tos if I'm having a bad day is The Good Life. I've got the whole box set. And if I went on Mastermind, my specialist subject might be The Good Life. Anyway, I picked out a particular clip that makes me laugh because if this was reality, it'd be so easy. So I'm just going to play it to you now, and blame Sally Spencer because she said have fun with your inaugural. So this is me having fun. She's not here actually, but yeah, it's recorded. It's your fault, Sally. There we go.
here.
Tom, I was worried about putting that little runt back with the other piglets.
Yeah.
Well, I needn't have. He's a little bully. He's just beaten up two of his brothers.
Good show.
What are you doing?
Oh, nothing much. I'm just about to roll back the frontiers of science, that's all.
Yes, but what are you doing?
Setting up our talking to plants experiment.
Well, why can't we just chat to them while we're working in the garden?
No. It's too hit and miss. You see, now sometimes we're in a good mood, and sometimes we're in a rotten mood. Well, they wouldn't know whether they were coming or going, would they? Now, I'm going to measure this thing from scratch.
All right, Einstein, have it your way.
Now, right. Now, pay attention. Plant A, plant B, plant C. Okay?
Yes, I think I grasp it so far.
Good. Now, plant A will be exposed to 20 seconds of affection and encouragement 5 times a day. All right? Plant B will simply fend for itself because it's the control, is it?
Yes, no, Professor.
Right. Now, plant C will be exposed for exactly the same time as plant A to derision and hate.
That's not fair.
Well, we'll make it up to it after the experiment.
So what I didn't tell you about that clip, because I forgot, was before then they'd been to their allotment. So I'm assuming that everyone knows about Tom and Barbara Good. So they live in Surbiton. They're trying to do self-sufficiency in Surbiton. And so they've got an allotment. They went there and they spotted this gentleman in his greenhouse, Mr. Watley, talking to plants. And not only that, but playing a record. I think it was Mantovani or something. So they went and said, what are you doing? So he went, oh, I'm playing music to my plants and I'm talking to them. So Tom goes, why? He said, well, it makes them grow bigger. And they were like, yeah. And Barbara's like, that's brilliant, yeah. So they were testing this out, basically, because they just didn't believe it. So if we try and unpack this a little bit, and yeah, apologies, that is a beautiful song thrush in my garden that ignores that sign every day. And it's a bit of a rebel. So yeah, if we look at this, were the beans randomly allocated? So we know that randomisation helps to reduce bias. So we don't know whether or not Tom's put the biggest bean in his pot or the smallest bean in Barbara's pot. We've no idea. We don't know who's randomly allocated this. Where's the control? Tom tested shouting and love, but I'm not convinced we really do shout at beans unless they don't grow. Sample size, only 3 beans. As a qualitative researcher, even I know that you cannot generalise from 3 beans. And the outcomes of a bean. Anyone grow and run of beans? Do they grow straight? No, they don't. So they're measuring them, and I'm thinking, well, they do this. So the outcome measure wasn't particularly brilliant. And Barbara and Tom, not really researchers. I mean, I guess you don't need a PhD to measure a bean, but you do need to have some kind of sensibility about what it is you're doing. So do we trust that trial? Or was it a trial? No, absolutely not. Absolutely not. So in reality, let's just unpack this, the challenges. So sample sizes. We need huge samples in order for us to kind of generalise and say this happened to this population. We can infer that this would happen to a similar population in similar circumstances. But with green social prescribing and nature-based interventions, often they're in small groups. And those small groups are used about 8 to 10. And if that programme is 12 weeks, that's 3 months. You've got 8 to 10 people, one group over 3 months. If we want 100 people in our sample, what do we do? Do we have lots of groups all crossing over? Do we have longer time to do the research? We've got seasons in the UK, although you wouldn't think it at the minute. It's just been beautiful sun, hasn't it? So how is that managed? And this is a real challenge. You know, how do we manage a sample size when the samples are so small? Because that's what makes it work. The fact that these people are in small groups, they're able to talk to each other. So that's the first challenge. Different interventions. So when we look, and I mentioned earlier, when we look at nature-based interventions, and I know we've got some delivery partners, some people that are doing this for real, it might be growing something, it might be sowing seeds, it might be digging a hole, it could be anything. So nature-based intervention differs from service to service to service. So how then do we compare? We can't compare apples and pears, you know, how do we do that? the only thing that is similar is the fact that they're all using nature in some way. And then there's the bias in relationships. I'm just going to put the next ones on because they're all very similar. So when we do research with organisations that provide nature-based interventions as part of a social prescription, they're working with people who obviously might have been quite vulnerable, who've got a mental health problem. And typically you don't go and collect data from that individual. The people that are delivering the service do that because they're the ones that are working with that individual. I would not like it if someone came to me one day and said, "How's your mental health today, Michelle? Are you feeling a bit up and down? How's your drinking habits today?" Because A, I wouldn't tell them the truth, and B, I'd be thinking, how rude. But you have to develop a relationship. There has to be a rapport with somebody to get that honest feedback. But that also has dangers as well, because whoever you're talking to, because all of the measures that we use are self-reported measures, so the ONS4, the SWMWES, etc. They're all self-reported measures, and it's reliant upon that person telling you, in all their honesty, how they're feeling that day. And that is reliant upon the relationship that you have. And that relationship takes a long time to develop, particularly around things like mental health. So there is that bias automatically, and it has to be there, because otherwise, how would we really understand what that experience is like for that individual? And then we come to the data collection and the quality. So as researchers, we like oodles and oodles of data, and we like to know postcode, we like to know age, we like to know gender, we like to do all of that. But sometimes when people are in a conversation and they're taking data from somebody and they're going through the questionnaire, they might miss out the postcode. And we're like, well, no, we need that to demonstrate, well, actually, it kind of works in these deprived areas. Or it might be that there's some missing data because that individual doesn't feel like giving him that data on that day. Yeah. So the quality of the data isn't always what we'd like it to be. And then, of course, there are sensitive questions. So we've just spent, Penny, how long have we spent writing protocols? You go, don't even go there. Yeah. So we've just spent a few months writing a research protocol for a randomised control trial. And a lot of that work has been about negotiation with the organisations who are going to be delivering this. Okay, what sample size? How are you going to do this? Randomisation, really? Anyway, so we've got through all of that last bit, questionnaires. We don't like that question on sexual orientation. And if you think about what's been in the news recently, these are really sensitive things. And so as researchers, we need to be sensitive, and we need to be person-centred in our approach as well. So those are the challenges, that's the reality. And so how is the research community tackling this? Because nothing is perfect, and I've never ever come across a piece of perfect research in my entire career. So we need to be thinking about understand what works for who and why. And it's about using that blend of evidence. It's about saying, okay, we need the quantitative evidence, we need the randomised control trials, we need that statsy stuff, we need the numbers, but we also need to understand why we're getting those numbers. We also need to understand what that experience is like. But more importantly, we need to be able to learn from each other. So as researchers in the research community, we need to be able to be honest and say, you know what, I've no idea how to do this. We need to be able to pick up the phone or go onto Teams and say, have you done this randomisation before? How the heck have you done it? And I have done that. I have literally been teamsing people going, how do we do this? We've had a number of conversations with our European colleagues about how do we make this work. Last year, I was very honoured to receive some funding from Edge Hill to set up an academic, I have to read it because it's called APRIN because it's got such a long title, Academic and Practitioner International Research in Nature Network. It doesn't kind of flow off the tongue, so we called it APRIN, and that amazing design is by Michael, who's here. There he is, yes. So that APRIN group was brought together at the back end of last year, and this was to bring together our colleagues from across the UK, our academic colleagues that are working in this space, plus our delivery partners, to try and understand what kind of methods work for who. What can we best do? How can we work together to better understand how we get the best evidence to support future commissioning of nature-based interventions? So the Green Me is a huge Horizon funded project over 6 countries. The Receipters is another Horizon funded project over 6 countries. That one is looking particularly at the impact of gardens and social isolation. We've just connected with the Nature and Health Alliance in Texas. When I was online to them a couple of weeks ago, it was raining there, and I go, it's really sunny here. We've been doing some work with the National Academy of Social Prescribing, looking at the impact of green social prescribing in long-term conditions. That picture there is a motley crew that was at the Apron event here a couple of months ago. And the Green Me team have set up the Network Nature, again, across Europe. And we've also managed to entice my colleague from Kyoto into this group as well. There are multiple organisations and social prescribing networks involved. And this is all to try and just understand, how do we get over these challenges? How can we work together to do that? And how can we make an absolute difference to the people that we're trying to support? And so at a grassroots level, there's lots of things that we've been doing as well to try and kind of spread the word. On International Social Prescribing Day on the 19th of March this year, we had our Dose of Nature walk. I think our 2 guys, Neil and Andy here as well, who persuaded us to have lots of these walks, and Faye. And at the end of that walk, 70 odd people turned up to that from the community, academics, students. We all wandered round here, and it was beautiful weather, thankfully, but we did have a brolly monitor, which was Eve over there. And we basically talked about mental health, and we walked around. And at the end of that, Yasmin, I don't think Yas is here tonight, she launched our first social prescribing service for students here, which is just amazing. We've also done a similar event, not a walk and talk, but we've done a community engagement event with the RHS. In April, there was over 110 people turned up to that. We had people talking about the research to people from the community. We had a really good day. Again, the sun shone for some strange reason. I think we're kind of booking it in early. I've done talks for the University of the Third Age. So we're trying to influence at a grassroots level as well, the impact of nature on wellbeing, trying to get people out there and engaged in and experiencing all those senses. We're also influencing the workforce, so the Personalised Care Interprofessional Education Network, which I co-chair with Jackie over there. This has been going for 4 years now. We're trying to convince student nurses, medical students, allied health professions that we don't always have to fix people. And that actually, if we start to look at working with places like the Marmot communities or in social care, or even getting them out into working with organisations that provide nature-based interventions, they can start to see the person, not just the patient. And we're not saying throw the baby out with the bathwater here and think about that medical model. We're thinking about how do they work in conjunction? How do we complement that learning through getting our students to think about that? How do we send them to placements that isn't just the NHS where they fix people? And so the impact on practice, we're trying to do an economic analysis to influence future commissioning of green social prescribing. There's lots of different types of outreach at the moment. Excuse me. And there's lots of organisations that are providing those outreach services. So they're going out to communities to provide nature-based interventions. So before my voice gives up, is it time for a natural health service? Is anyone convinced? Yeah, please say yeah, don't say no. Okay, so yes, but there's no funding pot at the end of the rainbow. I think this is my thoughts, that nature-based interventions shouldn't be seen as unique, they should be seen as normal. It should be built into part of our system as usual practice. I'll give you a tiny little example of this and how we can influence not just people going out to receive nature-based interventions, but bringing that into a service as well. So a couple of years ago, I worked with some advanced practitioners on a project management and methods of inquiry module. And their project, they'd read those papers that said that if you get more sunlight on somebody who's ventilated in intensive care, for example, then less likely to have delirium and hallucinations post-recovery. So they set up a system in their trust where they literally could push these patients on the beds with a huge battery out into the natural air. They made sure that there was window space. They made sure that there was natural light. So maybe this is about making better use of NHS spaces as well. And I know there's a lot of work from a lot of organisations that are reaching into the NHS to improve their gardens and to improve that kind of wider environment for not just patients but for staff and carers and relatives. And yeah, we do need to experiment more to influence commissioners, but that's what those large projects are all about. And we have to be dedicated to spend all those hours, Penny, on that protocol. And we probably need to expand our outcomes as well, because there is very little out there. We've done an awful lot of work around the impacts of green social prescribing on mental health, but not a lot on pain. Charlotte, you raised this again a few weeks ago. Chronic pain management. I mean, you can assume that if you're improving somebody's mental health, you might improve their pain management, but we don't know that. Or employability. You know, what skills are we giving people to go out there, and how could that convince, and how could that convince commissioners? We also need to raise awareness with referrers. So some of the stakeholder work we've done has highlighted that some link workers aren't really aware of the nature-based prescription bit, and so we need to do some work to raise awareness there. And biggie, we need to improve our access to nature. There's a lovely example that I came across where there was a little garden space attached to a food bank in the middle of a really deprived area. And for me, that was just amazing, because you've got people being able to access our space in the middle of all this area deprivation. There's broken glass and needles, and they were able to access that space and work with those individuals and work with that service. We need to use our own campus, and we're starting to do that, hence we've got the amazing gardeners here. So I think it's, you know, it's about that kind of whole system approach, so it's seen as normal and everyday practice. And we do need to convince the public, so after today you need to go out and shout about this, because people go to a clinician, a GP, an advanced practitioner because they sometimes want fixing, and sometimes a pill isn't the answer. And we need to say, no, actually, go for a walk. Go up the hill to Gaddins. There's skylarks up there. You won't see them, but you'll definitely hear them. Bring back the flowers. My personal tirade, bring back the flowers. Why can't we have flowers? And it's especially the need to share. And we have to collaborate to be able to innovate. And so finally, as I said at the start, a huge thank you to everybody. And I've tried to list as many people as possible that have been involved in the research that I've been undertaking over the past X number of years. And it truly has been an amazing journey, and you do not do research in isolation. It takes a massive team effort, and I certainly wouldn't be stood here without all of those people, and a lot of those people are in this room tonight, so thank you. And my final parting gift is, you'll never look back on your life and think, I spent too much time in nature. I don't know how long that was.
Perfect timing.
Was it? Okay.
So I'm Jeremy Brown. I'm Associate Dean for Research and Innovation in the Faculty of Health, Social Care and Medicine. It feels really quite a privilege to formally thank you on behalf of everyone in the room and everyone online for what was a truly inspirational inaugural. You had the words sharing and collaborate late on and throughout, and having got to know you so well over the last couple of years, you share, you support us, and that collaboration is both within here at Edge Hill, but the wider community and all your collaborators. And I think we always talk about research impact, but that actual collaboration and that every day is a school day just always fits so well when you say it. And I think just to say now, we have got time for questions. So thinking about, I think we've got 10 minutes, but in terms of team effort, we've got Ben and Zara. We're going to coordinate the initial questions from inside the room, and then we're going to look for questions online. So over to you for questions. Thank you.
Oh, no.
It's not a stats question.
Think of it.
I just wondered where you felt, or if you felt, there was a role for social media in this. Because listening to you speak, it sounds like the people you are convincing most are the users and not the controllers, if you like. And I just wondered if you hadn't thought that social media had a role.
Gosh, I think I'd probably shy away a bit from social media, but I guess it's a really good question, Cal. It's how do I kind of reach out through social media? And you mean things like LinkedIn and...
Well, no, I think I was thinking more. I mean, if you look at something like Mumsnet, which
Oh, I
is
see.
like
Yeah.
15 mums whining about their husbands and how awful their kids were, and it's now a serious political force, and is referred to in Parliament. That's a grassroots movement that has just gone, wow.
Yeah.
I'm not suggesting you get as deranged as Mumsnet, but I'm just wondering if there's a possibility there. Sorry if anybody here is on
Carol's my ex-supervisor, very good friend. Yeah, I'd not actually thought of that. I've always done the networks as in on a Teams and getting people together, and not really kind of broadcast it further than that. But actually, you raise a really good point, and it's maybe something I can start to look at. Yeah, research bid. Yeah, I know. So yeah, and I just wonder where that reach would be though as well, and how far we could take it. But saying that, I know, Chris, for example, there's some podcasts that will be coming up. And that kind of stretching out through those mediums as well would, I guess, be part of that. So we could certainly take it forward. Victoria's nodding her head next. So me and Victoria work with the Centre of Social Responsibility, and that's something we could probably look at. Because we do things like collaboration cafes, but as you say, it's not wide enough. It's not hitting that bigger audience, is it?
All the demographics, don't you? Not just
Yeah.
the old ladies like me that go, oh, 1960s would be lovely, but
Yeah.
you know, kids as well catching early.
Good point. I'll take that back. Thanks, Carol.
I was just wondering, are you aware of like anything from schools who are doing this type of work as well?
I think there are, so there is things like the green curriculum, and there are schools that are using things like forest schools. And I know that, for example, schools with learning disability focus have used sensory gardens for a long time. So there is that kind of work going on. I think it's very confined to the schools. I don't know to what extent when they leave school, they're then a part of nature. And I know that's kind of interest at the moment. So I know there's a kind of a huge call out around children, young people and mental health, but in particular, you know, how we use nature to improve. But I mean, it's a conversation I've had with people like Sean and Eve. You know, how do we get people engaged? How do we get kids engaged with nature? And you think, well, they do to some degree because they're out playing football or cricket. Or you think about, you know, Duke of Edinburgh or Scouts or Guys. So they're doing it in some way or format, but probably not enough because the rest of the time it's this. So, yeah, I think there's probably a lot more scope to engage with schools and get that kind of because then you're improving people's physical activity as well as their mental health and trying to kind of tackle that rise in obesity in children and young people as well. So there is a movement there. There's less evidence about children and young people social prescribing than there is about adults social prescribing.
I was just thinking during the time, I don't know if anyone here went to States High School, but that's where I went, like literally about 20 years ago. And when I got there, so it was 25 years ago, we used to have this thing in the middle called the quad. So it was like, it was in the middle of the buildings, and it was just all like a garden, they had peacocks there, and so that's where the naughty kids went. And I was thinking, oh, I understand that now, and there was a particular staff member who used to run it, so she obviously knew what was going on there, getting the you know, challenging children in there and working with them, and then I think she left, and then it just kind of went to ruin then.
Yeah. It's always the person that's like a champion. I used to help out my son's school at the primary school and run the little allotment there, but as soon as I went, nobody kind of took it over. So it's kind of building that model where it's, you know, sustainable. Yeah.
Sorry, one moment, because question online.
Oh gosh.
So we've got one online from Kate saying, Michelle, thank you, that was wonderful. What has been your favourite part of your career thus far?
Oh, flipping heck. enough as we can. I genuinely don't. I'm one of these people that I've enjoyed my career, yeah, I think I genuinely don't know. I've apart from the odd hiccup with some research that's caused an incredible amount of stress. I actually have enjoyed all of it. I really have. I'm liking being an early career researcher professor. I'm liking this bit quite a lot.
I think this might be a good order of the questions as it went, because as the previous person was asking about the past, I'm thinking about the future. By the way, before I ask the question, thank you for being in our lives.
Oh, thank you, Vicky.
Wonderful to work with you.
Thank you.
So thinking about the future, I'm thinking as a researcher, if often we jump from one to another, depending on where the funding is and what have you within our broad domain, but if funding was not a limitation, you could have as much money as your hearts, as much as you wanted, what would be the ideal research project you would engage with that will have, appropriate impact, will shift things?
I think it's something that we're working towards with an application at the moment. That's access for all. I think it strikes me that we know nature really works for a range of different outcomes. We know it works for the young, the old, the middle-aged, and in the most part it's free, and it's out there, but there are places that are inaccessible that don't get to green spaces. And I think if I had lots of money, I would identify where those spaces were and I'd put green spaces in there, or blue, clean up the rivers or whatever so people could go swimming, I don't know, and then test it and evaluate it. So I think a bit like the Gaddins at the start, I really would love to believe that mill owner put that beach in, but who knows? And families go up there all the time and use it, and it's just an amazing place. So yeah, I think I'd make it so it's available for everybody.
Just got one more online.
So we've got one from Christine online saying, is there an opportunity for nature interventions to be used as part of student action plans, e.g. in support study cases or other students being supported by the university's mental health and wellbeing team?
That should go to Fair, really. Is there an opportunity for students to nature intervention? Yeah.
There's already some great things that exist on campus that students can engage with and with nature. However, we have been working with the landscaping team so that as our social subscriber, we can have something a bit more of a project where we say, when you go here each week. So we've been working.
Can't people just hear me? I don't think our voice. Yes, the answer is I'm working on it. I'll start again. So there are lots of places on campus that maybe people don't necessarily know about, where people can engage with nature. They can just go along themselves. However, we are working with our social prescriber at the moment to develop green spaces on campus that students can be actually referred into. Maybe they can go together as a group. So it's definitely in the pipeline, and been working closely with the landscaping team to do that.
And we're also working with Alison, and there was a model down in Kent when we went down to Kent University on a Green Me meeting that I think it was this year. And Kent University has got quite a large green space, and they were working with Mind in the community, and Mind were running the green space and students were accessing it, so there was that constant sustainable model. So, but I know there's a lot of work now, there's a gardening group and a lot of work going on to try and establish some green spaces here, because we do have an amazing place at the back of the crime house with a greenhouse and everything. So yeah, it's definitely on the cards.
Hello.
Oh, hiya.
Just wondered, is there any evidence of mental health issues with rural schools and urban schools? Is there a kind of like is it inner city schools where you get more children with mental health issues?
I
Or is it not
Yeah, no, I think so. There are problems with rural schools. So there's a project that we're doing at the moment with an organisation, looking at Julie now, and and that's a children and young people social prescribing programme. And a lot of the issues with children in rural communities are the fact that they're isolated and there's no employment. So I think there's problems both in urban and rural areas, but can be different causes. So yeah, even though they're in beautiful areas in the Lake District, they still struggle because of socialisation and no employment. Yeah.
Yeah, I suppose all kids are in bedrooms playing games and
Yeah.
rather than being
Yeah.
honest.
We need to get them all off.
Exercise is a key issue as well, isn't it?
Yeah.
Yeah.
If we can get people outside using spaces, and we just need to think about different strategies to do that, but not, completely throw out the baby in the, mobile phones, because that's not going to happen. But how do we then utilise and build on things where we get them to use technology? Who was I having a conversation with recently? We did a schools campaign. It was actually with the RHS, and they'd come and they were doing. Do you remember? Mike, it was. So we were doing. All the schools came to get their awards for the RHS school gardening campaign, and we were tasked with kind of working with the children outside. So whilst they were going through the process of the awards, we were working with different groups of children. So we asked one of our computer sciences students to put an app together on an iPad, and we did a treasure hunt. So they had technology, and we did a treasure hunt in Peel Park campus at the back of Salford University. And that was brilliant. It engaged them. They had the bit of tech, and they were like, oh, and they scanned over the QR codes and they're off. And it's trying to think things like that, what will get kids engaged with technology outside rather than taking it off them, I think. So, great question.
Thanks, Michelle. So I think that brings us to the end of the evening. I'm sure we'll have more questions and more conversation outside in the foyer. But again, on behalf of everyone here in the room and everyone online, thanks so much, Michelle.
Thank you.